Let's now talk about vaccine equity, our continuing focus here on Gravitas. Last night, we told you how rich countries are hoarding vaccines. Today, we will tell you how they are also wasting vaccines and politicizing vaccines. Europe bought 400 million doses of the Oxford AstraZeneca vaccines. It is now wasting the life-saving drugs. In Germany, over 14 lakh doses of AstraZeneca vaccines were delivered. It administered only 1,89,000 doses. As of the 24th of February, the number of unused doses over 12,62,000. In Italy, nearly 5 lakh doses were delivered. It administered less than a lakh. The number of unused doses over 4,02,000. Over 2 lakh doses were delivered to Belgium. It could not administer even 10,000 doses as of the 24th of February, so the number of unused doses over 1,91,000. Here's a look now at the numbers from Austria. Bulgaria, the story is the same. The situation no different in Sweden as well. The Guardian says 4 out of 5 of the Oxford AstraZeneca vaccine doses that have been delivered to the European Union countries are yet to be used. What explains this? European countries have used 80% of their available Pfizer jabs. Why then are they wasting the AstraZeneca ones? What explains this discrimination? In January, French President Emmanuel Macron said the Oxford AstraZeneca jab was quote-unquote quasi-ineffective for older age groups. Germany is not using AstraZeneca vaccines for those above 65 years of age. Neither is France, even Poland or Italy. Why exactly is this happening? They're all citing the lack of clinical trial data when it comes to the elderly population. The European Union has approved the vaccine for all age groups, but national regulators are restricting the jabs to those below 65. In Germany, there is a call for updating the guidelines, but there is also ample misinformation. In January, a German daily published this report. It said the AstraZeneca vaccine may be only 8% effective among those over the age of 65 years. AstraZeneca called the report, quote-unquote, completely incorrect. The German Health Ministry also denied the report. It said 8% was the number of people in the study between the ages of 56 and 69. The fact is, fewer than 10% of the volunteers in the trials were in this age group, but results so far have been positive. Reports say the jab is cutting the chance of people aged 80 and over from contracting the Wuhan virus infection by 80%. And this is just a few weeks after the first dose. So why are European countries not administering the dose to the elderly? France recently changed its mind. The French health minister said that the AstraZeneca jabs would now be made available to those between 65 to 75 years of age with serious health risks. This mistrust with a certain vaccine is not all that black and white you see. It all began after the EU's feud with AstraZeneca. A quick recap here. Europe was supposed to receive 80 million doses of the AstraZeneca vaccine by the end of March. In January, AstraZeneca said it may only be able to deliver around 31 million doses. That is 60% less than the agreed amount. AstraZeneca was citing production issues at a Belgium factory, and Europe was crying breach of contract. Take a look.
Not being able to ensure manufacturing capacity is against the letter and the spirit of our agreement. In the contracts, there are four factories listed, but it does not differentiate between the UK and Europe. The UK factories are part of our advance purchase agreements, and this is why they have to deliver.
AstraZeneca finally offered to deliver 40 million doses by the first quarter of 2021, which is by the end of this month. My question is, what will the European countries do with these vaccines? Since it is obviously not inoculating people, There is no point playing politics over the jabs or discriminating against life-saving shots. You see, Europe's approach is helping no one, not the Europeans waiting to be vaccinated, not the experts fighting vaccine skepticism, or even its own goal of vaccinating 70% adults by the end of the summer. And let's not even get into discussing about those outside Europe desperately waiting for life-saving drugs as Europe is wasting them. Like I said, yesterday, 130 countries have not received a single dose of vaccine so far. And since we also spoke about India's expanding vaccination drive, here's a quick update. Earlier today, India's Health Minister Dr. Harshvardhan took his first vaccine shot. After taking the shot, the minister said, "I request everyone to get vaccinated. Do not worry if you experience minor side effects, but do let your doctors know." That is the minister's advice. Other Indian cabinet ministers, including Home Minister Amit Shah and External Affairs Minister S. Jaishankar, have also taken their first shot of the Wuhan virus vaccines. This is the world's largest vaccination program, and we will continue tracking all these updates. WION now available in your country. Download the app now. Get all the news on the move.